Hello, everyone. Welcome to Fighting Hunger Before, During, and After a Pandemic, a panel exploring food insecurity and COVID-19's impact on food access in the Greater Richmond Region. I'm Reggie Gordon. I'm the Deputy Chief Administrative Officer for Human Services for the City of Richmond, and I'll be your guide during this discussion with the panelists. This is an issue that is, of course, very intriguing, and we want to learn as much as we can, so I'm glad you've joined us today. We have a wonderful group of knowledgeable panelists, and I'm going to let them introduce themselves and tell you a little bit more about them, about their role in food access. Let's begin with Doug Pick. He's the CEO of Feed More. He's an effective and compassionate leader. Why don't you tell us your role, Doug Pick?
Thank you, Reggie, and hello to everybody. Sure to appreciate you taking the time with us today on this most important subject. So I'm honored to be the president and CEO of Feed More, which is Central Virginia's core hunger relief organization. Been here about 8 years following a career in business where I was 12 years with Capital One and 20 with IBM and a few other groups in between. But this has been the honor of my life and privilege to support this community in this way. Thank you, Reggie. Sure appreciate your leadership and facilitation today.
Thank you, Doug. Next, we have Eddie Oliver. He is a person that really understands the governmental statewide impact of the food system. He's even spent some time working with former First Lady Dorothy McAuliffe. Eddie is now the Executive Director of the Federation of Virginia Food Banks. Hello, Eddie.
Thanks, Reggie. Good afternoon, everybody. I'm really excited to be part of this panel. I've been a food banker for about 10 years now. Of course, have never experienced a crisis quite like this. And so we have lots of good hunger fighters here in Virginia, and just glad to be talking with you all today.
Great. Thanks, Eddie. Next, I have Janice Smith. Jana is the Director of Community Health with the YMCA of Greater Richmond, and she is our Help One RVA champion. Hi, Jana.
Hey, Reggie. Yep, I work with YMCA of Greater Richmond. I've been with the YMCA for about 15 years, and I support our community health programs across the metro area, as well as I help facilitate some leadership for community health or chronic condition programs across the state of Virginia as well. So we're spending, I help lead the charge, I should say, with Help One RVA, and I think we'll dig into that a little bit later. So.
Perfect. Thanks, Jana. And we have Shadae Harris. Shadae is on Superintendent Jason Cameras' team. She's the Chief Engagement Officer with Richmond Public Schools. Hi, Shadae.
Good afternoon, everyone. Excited to be here. I have the privilege of representing Richmond Public Schools and really doing this work with our families and community. We serve over 24,000 students, and I lead the Office of Engagement, which is all about how do we make sure that we're not doing things to our families, our communities, but really with them. So thank you for having me.
Great. Those are our panelists. Thank you. We're going to spend about an hour on this panel and this discussion. Before we get started, I wanted to thank two people who are behind the scenes getting us ready for today. Sam Schwarzkopf, who's the Communications and Policy Analyst for the Office of the Press Secretary for the Mayor, and Susan Baxter, who's the Principal Partner with SIR, a local consulting firm. Thank you both very much. Now, let's jump in. And this question is for Doug to get us started. Can you provide us with some context here? What did Richmond's food system look like before COVID-19? Were we prepared for the shock of COVID-19?
Yes and no.
Okay.
Were we prepared? So the food system was in fine shape, was in solid shape, Reggie. Remembering that food banks and all of our many, many agencies and all the great work that Shadae and her team in Richmond City Schools have done is all wonderful, but the food stamps, the SNAP system was also in place. And it's so important to remember how much that government assistance matters to our community, and probably more so now than ever. So when you talk about a food system, it's not just food banks, it's not just my friend Jana and the YMCA and what they do, as partners with us. It's also the government assistance, which is so important. Now, having said that, let me stick to my knitting and what we do at Feedmore in the hunger relief industry, if you will. We're part of Feeding America. There's 205 of us very large food banks here in the country. But we were in good shape. Last year, we moved about 25 million meals, 25 plus million meals. It's probably close to 32 million pounds. That got us in the 75% range of helping handle all the food insecurity in our service area, which is probably bigger than most people know. It's 29 counties and 5 cities. So it truly does cover all of Central Virginia, all the way down to the North Carolina border. We do this through 272 agencies. 70% of them are places of faith. Friends with the Y are also an agency, Boys and Girls Club, etc. They're the ones who distribute the food for us. And we have about 95 employees, but amazingly, we have over 200 volunteers a day who help make the magic happen here at Feedmore and around the Central Virginia part of the Commonwealth. So the answer was, yeah, we were in good shape and very solid and large, as our friends listening can now tell. And was it a shock? Sure it was, because did we see this coming? Not particularly. We knew pandemics were going to come sometime to this world and this country, and already have, and more to follow, but I don't think we all saw this with the severity and the urgency that it took on. So if you don't mind, Reggie, I'll spend a few minutes on kind of how we went about this and why it really wasn't a shock, because any large organization that's ours, and any organization, whether it's the city or anybody else, or the school system, needs to be prepared for issues and for different situations. So on March 2nd, we received a deck, a PowerPoint presentation for VCU Health System, predicted as many as 9 million cases and 500,000 deaths. And many people, when I repeated that, said, no way, not even close. I said, well, suppose it's 20% of that. That's still really dire for the country. And I think we're all aware of today's numbers approaching 4.7 million, over 152,000 deaths. So it was very real and coming very quickly. So the next day on the 3rd, the senior leadership team got together and came up with a bunch of scenarios and mitigation strategies. And that's really, in any of these things, you don't want to react too quickly. You don't want to overreact. You don't want to panic. You want to say, what's coming? How can I ground it in the best data and information I can? And then what are the mitigation strategies based on the various scenarios? And usually you try to keep your scenarios between 2, 3, or 4 different scenarios. So in our case, we looked first at our employees, then volunteers, agencies, and then food sourcing. Our employees, it was all about safety. We did very quickly what everyone else did, got the right safety precautions in place, split out our workforce, some home, some here, et cetera. And that has gone. Our volunteers, we knew, would quickly fall off the cliff. When you have 200 a day, that's really important that you keep them. Our corporate volunteers went down. We thought that would happen because they were all working from home. And our seniors, so many of them volunteer, they too fell off. And early on, we quickly had 300 new names show up. So that shows the great heart of this community. And since then, we were up to 1,500 new names. So that's quite something. Our agencies, and this is really important, that's our distribution system. That's the infrastructure we spend so much time investing in and working with these folks. And the question is, would that hold up? And indeed it did. So of 272, we quickly lost about 35 agencies. Within a couple weeks, about 10 came back, so we're down 25. So not awful. We had 27 large agencies, which if they went down, really would affect the communities involved with them. And they stayed up, and we got a bunch of these other agencies back. We've lost 7 permanently, 12 permanently, but we've added 7 new ones. So we're now down 5, and that's just fine in terms of staying ahead. One thing I'll let people know, that you saw these long lines of cars in these communities. Of those 3 large agencies that you saw in the news, between 2 in Texas and 1 in Pennsylvania, only 1 of them lost their infrastructure. We were prepared to do the same distributions if we lost our agency network, and we didn't. So a couple of them, I will say, went too quickly, too reactively, and they did these long lines. It was a law of unintended consequences. Next thing you know, 10-mile long lines. Not all those folks needed that food, in all honesty, Reggie and everybody. But that's how it came about, and we didn't have to go there, and we choose not to do that if we can work with our agencies have this 200 and some odd, 250 plus agencies, 260 agencies be prepared to hand out the food. And then food sourcing was a really big deal. What was going to happen to the retail grocery stores? What was going to happen to industrial? We get 60% of our food, believe it or not, from retail grocery stores. We assign these 272 agencies. You know, Shade's agency will go on Tuesday, mine will go on Thursday, and Reggie, yours will go on Saturday to that Kroger or that Wegmans or that Publix or whoever it may be, food line, who you live near. So when that food went away completely, because we found there was, the first surge was 5X, and then when the governor shut down, it was then a 3X surge. So everyone very quickly felt, what happens if you aren't sure your next meal is coming from? There's quite an education for the general population who probably hasn't had to even consider that. That may have been as a result of some of the largesse we've seen from everybody went, wow, what a way to live. It's to see the folks we serve each and every day. So those donations went down to nothing. And then within about 6 weeks, they came up to 50%, and that's now leveled out. The institutions, we predicted that the protein situation would be bad because we saw their lack of safety practices, and indeed that happened and really shut a lot of that down. That's coming back. They learned their lesson, and the government has been amazing. I won't go through all the government programs. Eddie may do that in a bit, but they've flooded the zone with food, and that's really helped quite a bit. So those are the places we looked at and what we had to worry about, and not that folks probably care much. We also had to worry about our revenue sources. This affected the economy in a huge way, and we wondered whether that would affect us. Wonderfully, as often happens at time of disaster, food banks do very, very well, and the community really came through and was outstanding with their effort and their support. Our programs are something we care an awful lot about. Meals on Wheels went from 650 seniors a day, serving them at their doorstep, up to 950 within a 3-week period. So close to a 50% increase, and we were able to handle that. Our kitchen is working, was working like you wouldn't believe. We split the kitchen, one half in one building, one in the other half, so that if one half got sick, the other half didn't, because if our kitchen goes down, there goes food for not only the 950 seniors we serve in this vicinity, we also serve 1,600 frozen meals in other places in the rural areas. One of our mitigation strategies was to reduce, instead of delivering every day, just deliver 1 day a week because of the reduction in volunteers. Again, the mitigation strategies and scenarios really played out. It's also 4 less touch points for our seniors who are so at risk. And that's worked out beautifully. We made that transition within 3 days because we had the plans in place. So in the end, it's gone quite well. You know, our canary in the coal mine was also our front desk. We went from about 50 calls looking for food every week up to 250 calls, a 5X surge. And by the way, we're now up to, in the last couple of weeks, we're back up to 150. And we'll talk about it later, but I expect those numbers to zoom up again, particularly given the dysfunction within the government right now, trying to add additional assistance to everybody, which is so sorely needed. So that's probably enough, Reggie, for kind of. I just think it's important for everyone to remember that in times of emergency, the folks who brag about how many hours they work, the folks who go after the martyrdom, who want to be dramatic with how hard they work and how well they're doing, is not leadership in this community. It's the same reason I go back and look at the mayor in Lincoln, the chief of staff, asking us to create a task force in a very proactive way, where we went after looking at the retail food situation, the food sourcing in general, the restaurant situation, which is so important to the chemistry and vibrancy of this city, as well as a revenue source, and finally the ability to predict where the need was coming, which is still an ongoing project with my friend Susan Baxter and others. So kudos to the city for understanding that this is not a reactive game. And you have to say no to a lot of people, Reggie. You have to, who all want to offer help. And Shadae knows that. Everybody wants to help. But right. The scale that we do and what Shadae and RPS has been working at, you must not get caught up in taking on the little favors people want to provide. You've got to remember your mission. You got to remember your core competencies. Go with what you invested in. Stay in your lane. Calm, productive, stable reactions is what these things require. And quite honestly, we still have that ahead of us. So with that,
Right. No, that was perfect. Thank you. Thank you, Doug. Now let's talk to Eddie and Shadae. So what emergency response, what did it look like for you in each of your respective sectors? And do you think we've leveled out at this point, or are you still operating in a crisis management mode? Let's begin with Eddie.
So I work on behalf of all 7 food banks throughout the state. You can see the service area map behind my shoulder there. So each food bank has their own unique geographies they serve, one of which is, of course, is Feedmore here in Richmond. So my perspective is a little different than Doug's, but of course there's a lot of overlap here. I just want to start by touching on what food insecurity in Virginia looked like before the crisis. We're looking at 1 out of every 10 Virginians was food insecure, meaning at some point during the year, they couldn't afford enough nutritious food to eat. And that was about 840,000 people. Food banks were distributing 120 million pounds of food a year to 1,500 community agencies, pantries, soup kitchens, homeless shelters. And I just want to underscore the point, what Doug already mentioned, SNAP, despite all the food that we distribute, we only provide 1 meal for every 9 that SNAP does, food stamps. So that just really underscores the critical nature of that program. Of course, the second we knew that the pandemic was going to start closing down businesses, we started to see the job losses piling up. We did go into emergency response mode. Doug did a great job talking about how resilient our agency network is. We did a good job statewide of those pantries staying open. We have a lot of really heroic volunteers who serve on the front lines of our pantries, who quickly operated low-touch distributions in a safe manner to get people the food who needed it. But you know, we work in close partnership with the state because of how critical all these government programs are. And I really have to commend, we have a lot of great leaders at the state, from the governor all the way down to state agency leaders like Duke Storin at Social Services, who comes from the anti-hunger community, has worked in this space a long time. And we were very quick to take advantage of all the waivers and flexibilities for all these programs. So we immediately started doing maximum SNAP benefits to people who are already on the program. We applied for the pandemic EBT program as soon as possible, which is a benefit card, much like SNAP, that every student on free or reduced meals get. And we got commodity programs approved. The Department of Agriculture has been a great partner as well, that allowed us to open up some of the restrictions that were on us for the government commodity programs. So there was a real flurry of activity there. The federal government acted quickly to pass a lot of the stimulus we've already talked about. Of course, the individual checks, the additional unemployment benefits, all those things really kept us afloat and kept us from having a more severe situation than we could have had. Despite all that, we had about 20% more people coming to our pantries statewide. Some areas like Northern Virginia saw twice as many people coming to their pantries. Grocery store donations, Doug already mentioned, make up the majority of our food source. Those fell off a cliff because of panic buying, changed shopping habits. People were only shopping for the shelf-stable items out of the center of the store, so we had to adjust to that. And so we had to increase our purchasing. So we had some food banks purchasing more food in a month than they had the entire previous year. So it has been a big change. And I'd say, from my perspective, we've leveled out to a large degree, but again, only because a lot of the stimulus has continued to stay in place. We're just now at the point where the additional unemployment benefits aren't authorized. There's no sense of whether pandemic EBT is going to continue next school year. When are the additional individual checks going to come? We don't know. And meanwhile, the case for economic recovery, it's definitely not going to be V-shaped. At best case, it's going to be U-shaped, where it's bottomed out for a few months now and will start to gradually pick back up. But even that, I think, is pretty optimistic. So we're in this for the long haul. And it's a marathon, it's not a sprint. And everyone in this sector, I think, needs to be aware of that. We've had a lot of great partners from the business sector as well as government who are working with us to get additional resources. for the food banks. The governor's office authorized $1.4 million in stimulus funds, the CARES Act, that have gone to the food banks for shelf-stable food purchasing, so we can get these pre-packed boxes out to homebound seniors, people who may be food insecure and quarantining due to a possible infection, and other newly unemployed households. So we're being really strategic with that, leveraging resources at the statewide level, but very clear-eyed that this is a situation that's going to be with us for some time, and I'll talk about this later, but we really need everyone in this space to be advocates and speaking up for the fact that we're going to need additional resources.
Good. Thank you, Eddie. What about your sector, Shadae?
So at RPS, we quickly went into go mode, recognizing that when schools are closed, there would be an immediate need to ensure that our students still had access to healthy food. So the first thing we did is establish food sites at our school. And that had kind of been the traditional way of having these walk-up sites at the schools. But we know we needed to do more to eliminate barriers that prevented our families from getting to school, such as transportation. So we shifted to more of a community food-based site delivery model, where we then use kind of bus stops as hub spots in the community to really just meet families where they are. I remember when we first started, we had our walk-up sites, but then we had like 20 walk-up sites and only 15 mobile sites. And then throughout that process, we really just listened and heard from the community that you have to meet us in the community. This is much more efficient for us, and we need this service. So we shifted our strategy to really meet the needs of the community, and we reduced our walk-up sites and increased our mobile sites. So we went from 14 to almost over 45 sites in the community, where families had closer proximity to get to schools. And then we utilized the amazing Richmond community, and I think from over the past couple months have had over 4,000 volunteers who helped ride school buses with our amazing drivers to distribute meal bags in the community. We also recognized that families' breakfast and lunch wasn't enough. So through waivers and requests from the state, we were able to add weekend meals. So again, constantly looking at our strategy and figuring out and listening to our families and figuring out how we can continue to adapt. I think the other thing that was really powerful that we had to do quickly is recognize for our families who are in housing transition. So many of our families that may be in shelters or motels, we may need a different strategy. So in addition to having the mobile sites, we also utilize volunteers to deliver 2 bags of groceries to over 200 families who were in housing transition. And they received the door-to-door delivery of those groceries every week. And we were able to kind of start with 50 families, increase to 75, and then have a steady pace of 200 that will now, because of some amazing grants we received, be able to continue into the fall. So again, all about just kind of shifting our strategy, but making sure that we're really meeting needs of the community. And again, listening to our families and our students. And we continued that model over the summer. Normally that's the model we do in the summer with having these mobile sites. But
Right.
given that that's what was working, we continued that distribution model and still had 22 park and rec sites that were also open, but we wanted to maintain our model as well. So we really increased, I think, than any other summer, how many available places families could get food through that partnership across the city. So I would say at this point, our systems have leveled out, but our goal has remained the same. How do we continue to provide services and information so all of our families who need food have access?
Excellent. Thank you, Shadae. A lot of hard work there. I'm going to ask a question that sort of circles back to something that Doug said. So I guess this is for you to respond, Doug, but Eddie or Shadae, if you want to, or anyone else on the panel, provide some insight, that would be great too. So we have a food access support team, and that team, as Doug mentioned, has been working since March. Now we predict that in late August or early September, there'll be a huge increase in demonstrated need in the Richmond region. So can you explain why that is and who is going to be affected?
Yeah, absolutely. So you're right. We called it Food Assistance Support Team that the mayor and chief of staff wanted us to put together. And this idea of forecasting and trying to understand where the need is, getting out of react mode is so important. So within that, we know full well we've had a group of folks that we serve from I'll say low income, but quite honestly, I usually refer to the working poor. I won't get on my soapbox about a living wage or a minimum wage. That's another whole.
That's another webinar.
Another webinar, isn't it? But I can promise you that about 65% of the folks who receive assistance from us have income, just not enough. Just not enough. You know, it's shocking to me that 50% of this country does not have $500 at time of emergency. It's a small hospital bill. It's not a big, large car bill, and that really puts that family in tough times. So those folks we know, and they know us. They use us periodically, episodically, anywhere from once to 7 times a year. I always tell people that people do not aspire to work with food banks and SNAP. People are also very shocked to understand that SNAP, on average, is about $4.50 a day per person. It's called the SNAP Challenge. You try to live on $4.50 a day per person for a week and tell me how that goes for you. So I'm often dispelling a lot of myths on who we serve and what kind of assistance they really get. So that group we know, and we have. And they understand our system. They understand where the agencies are. They understand where our mobile distributions are. I promise you in the City of Richmond, they're learning to understand what Shade's team is doing for them. And they'll tell you that. Meanwhile, food stamps were surged and were doubled in some cases. Eddie can speak more to that. So that part we thought was okay, if it's ever okay, right? If it's ever okay. But in terms of our being able to manage to it. What we worried about was this next tier. Sometimes we call it the second quintile. And the newly unemployed, folks who've never used us, or it's been an awfully long time, who all of a sudden find themselves in this place. We predicted that we would do pretty well. We'd have a gap right in between when this hit and when government assistance landed. And indeed, as the government assistance landed, the summer has, I won't say it's been business as usual, it hasn't, but it hasn't been the huge surge we saw before. So what we look at now is where we're going. And if you look at this, for every 1% increase of unemployment from what it was, right, from its base, you can equate that to 0.5% increase in food insecurity. So let's suppose it was at 4%, and let's suppose now it's at 12% unemployment. I think I'm being generous, because some people would say it's really at 25%. But documented at somewhere around 12. So that is a 200% increase, right, from 4% to another 8% to 12%. So that would equal, half of that would be 100% increase in food insecurity. So we can see, unfortunately, line of sight to as much as, in our case, another 175 to 190,000 folks being food insecure. In the City of Richmond, which probably out of our whole service area, by the way, look behind Eddie's right ear there, that gray area is Feed More service area. Richmond's probably about 24% of that. And about 44,000 folks. And if you double that, all of a sudden we're at 88,000. We just have to predict better what zip code they're in and what census tract they're in, so we can do a much better job of getting to them. Not dissimilar to what Shadae said. The folks who've worked with us understand us. The new folks, how do we distribute to them? How do we get to people who are recently unemployed in a targeted fashion, so you know you're getting the best use of the food and of the donations that people gave us? So that's really what's ahead of us, and that's really where we see things going. In all honesty, this country kind of chose to do things in a sequential fashion versus simultaneous. If you look at the other countries in the world who were so much further ahead than us, it was all simultaneous, and they drove that thing all the way down to the bottom. Some folks drove it down, some folks drove it part way, opened up way too quick. And we're now in this sequential nature, which is now elongating this entire thing. And we worry mightily about a big fall spike, and which could create a full closure. And another moment, Reggie, let some other people talk. I can talk about what we're going to do for the second round and where we see things going. But right now, that's the group we're worried about, is the newly unemployed, beyond who we always worry about, and what we do to manage them. But the numbers could easily double for us. Right. And this, as Eddie said, this government assistance is everything right now to how those folks fare. It's everything. I just can't stress that enough in terms of advocacy. And by the way, just so we get it, Eddie's done a great job of managing our federation and leading that, but he also comes from a lot of government experience, not only the food bank industry, but he worked in the McAuliffe administration directly with the governor and the first lady, and has been a huge help to us and others through advocacy efforts. So I can't say enough about that, and want to make sure everyone understood his background beyond food bank.
Great. Thanks, Doug. So Shadae, what are your feelings about August, September? I know that we're facing a new school year and things will be different. What are you all thinking?
So we actually yesterday, as we think about reopening, as you know, the school board has decided that we will be completely virtual for the first semester, which has, again, a huge impact on our families, knowing that so many of our students rely on our schools for food security. But we have launched our Reopen with Love campaign. If you're not familiar, our district, our motto has been teach with love, lead with love, serve with love. So we are going to reopen with love. And you'll find on our website now our plan specifically for meal distribution. And what we've done, again, like we listened to our families, if this model is working, what we really needed to do was expand it. It didn't make sense to go back to walk-up sites. But we know for some of our larger sites that may work, but for the bulk of our district, we have to continue to be in the community. So we actually expanded our stops from 45 to 1,092. So we are going to be everywhere in the community. We have our first run, which will be early morning from 7 a.m. to 9 a.m., where we'll be distributing food for K to 12th grade. Kindergarten through 12th grade. And then in the afternoon, there'll be another run for some of our students who have special needs, who have door-to-door delivery, as well as our pre-K and Head Start students. If you have a sibling, you can go to either one of those. But again, we're exhausting our entire fleet of buses, bus drivers, to really meet the needs of our families and try to get in as many communities as possible so we can reopen with love. But at the same time, we know that we're just going to have to continue to iterate. That's like the biggest lesson we've learned, is we are going to try this as we launch September 8th, get feedback from the community. What areas are we missing? Where do we need to go to? And continue to shift. We'll be doing a deep dive even more so and really thinking about, as Doug shared, the newly unemployed, people who maybe were in stable housing that are not going to be in stable housing now, and how do we really not only support them with their meals, but also support them in their housing. So we've added that strand to our work as well, knowing that those are very interrelated. So it's important to us as we reopen this plan that you'll see online is that we have a multi-tiered approach, and that we recognize the effects, housing, food instability, all of these things, education,
Right.
all intersect with each other.
Got it. Thank you. Eddie, do you have anything to add to this particular question about what's on the horizon for August, September?
Yeah, it goes back to what I already mentioned about concerns around these stimulus programs ending. I think we're looking at a real gap between supply and demand from what the food banks are able to provide, assuming that we don't maintain the same levels of stimulus. And I just want to reiterate the importance of these school meal programs. The school nutrition programs throughout the state have been doing incredible work. I mean, these are real superheroes who've been working overtime and have been implementing these new distribution models at a fraction of the revenue that they had previously been bringing in, because school nutrition programs get reimbursed by the government for each meal they provide, and they're just inherently serving fewer meals because kids aren't in school. And so with less money, they're doing more work. And as long as kids continue to not be in school, we know we're not going to reach all the kids in need. I think Richmond is going to have one of the more extensive programs in the country, or at least in the Commonwealth. So we're grateful for that here in Richmond, but that's not necessarily going to be the case throughout the state. And so at least some of that slack is going to have to be picked up by food pantries and other emergency agencies in school divisions where kids might not have that same access.
Great. Thank you,
So,
Eddie.
Reggie, can I
Yes.
chime in?
Yes.
So I just want to also highlight what Shadae mentioned and the intersection of these different needs that people are having. And while we're talking specifically about food, but looking at the other ways in our community about where are the other organizations that are part of our networks, either very intentionally part of our networks or on the peripheral, and then how do we work with them to help get people the food or find the programs that they might need, and how are we being how are we lifting families up through different channels, and not only through those really intentional, if they're coming to the pantry or if we're doing food delivery, how else are we helping people identify or find those programs that maybe they need? And so I think, right, the FAST committee has been talking a lot about that too, and how do we shift it and look into the future, and how are we being proactive, and who are the people that we need to bring to the table to help be part of the conversation, to say, what are your mediums? How do we access the people you're supporting, so that way we can help get them connected to food programs that they might need. So just wanted to reinforce that message that Shadae.
Well, that was perfect. And I was about to transition to you anyway, Jana, because part of this, most of this deals with knowledge about resources in our community. And Help One RVA provides that platform. So to the folks who are watching this presentation, first sort of describe what Help One RVA is, what it portends for our agencies, and what people can do to grow it.
Yeah, absolutely. So Help One RVA, I think in the most simplistic terms, is like an electronic phone book of human service organizations and government agency organizations that are providing programs for various needs. And so, of course, in Richmond, through the pandemic, our top two needs that we were finding are food insecurity, or the accessing food, and then also housing, and how are they getting help for housing, whether it's eviction prevention, help paying utilities, help paying rent and mortgage. And so again, there's an intersection of need, right? And so Help One RVA is a platform that provides a place for people to list their programs. And then it also provides a platform for people to go and search for those programs with a simple zip code. So they can do it anonymously. They can do it very discreetly. If they're not familiar with this process, they're getting thrown into this because the pandemic is forcing them to have new needs. And so they can do a zip code search and find what are the food programs in their neighborhood that are going to be available to them when they are not taking care of their children. When can they go in the evening time? Are they bilingual services? So they can do a simple zip code search that way. And then, of course, on the other side of that, for the service providers, helping their constituents connect to those programs or other programs, because again, we have lots of intersectional needs, but also helping screen those participants if there's an eligibility piece there, helping provide ongoing case management or people support in keeping those that information, or where we're sending referrals, keeping that organized. And then there's also two-way communication between our agencies, where I can send somebody to a pantry down the street, and that pantry can say, yeah, they got help, or maybe I'm sending them to the health clinic, whatever that might be. And there's an easy way to get that two-way communication, so we know people are getting help. We're not just giving them a phone number and saying good luck. We're able to be really intentional about that network and help lift people up and follow up with them if that's really what they need.
Yes, that's great. Anybody else have any thoughts about resources in our community that we want to make sure that people pay attention to, or are outside of maybe what they might normally know about through Help One RBA?
Well, sure. With us, you can certainly call our main number, 521-2500, but mostly those folks will then send you to our website. They'll certainly talk you through agencies near you. On our website, where you look to the far right, there's an orange box that says Get Help. And that takes you straight to an agency locator, which can then show you the agencies, just like a Google map with all the little pins in it, where they are and what their hours are and what days they operate. So that's been a big help to folks. We would ask that people try to utilize that network. So from our point of view, that's the main thing. But I will also say that we are curious about other ways to distribute to this new tier of folks, this newly unemployed. So all ideas are welcome, but we can kind of do it, I wouldn't say surgically, but targeted in a way we know it's really hitting. So we're up for a little assistance on that, on anyone who has some thoughts and ideas. And then I have Reggie on another subject. I have a few other thoughts on what we see coming, but let the other folks answer, like Shadae on the assistance.
Well, yeah, while we're thinking about this, what have we learned? I mean, you all have been providing a lot of great information about the networks and how volunteers have responded and how we've listened to families and the public and Help One RBA. What are we learning about our community and our food system during this process, particularly as it comes to advocacy, maybe? So I'll let maybe Eddie start, and then everyone else can join in.
Well, as far as the food system goes, I think the fragility of the food system has been a huge lesson from this. We take for granted we can show up at the grocery store, those of us with means, and buy anything we want. And then all of a sudden, we found ourselves at the end of March, early April, with empty shelves at the grocery store, food banks, not knowing where we can get food. We had to purchase food several months in advance. So, I mean, the food system can get upended rather quickly. And I think that speaks to the importance of strong local and regional food systems. And that's something, just as a side note, we food banks have been trying to focus more on is how can we work in partnership with the agriculture sector in our state to source healthier foods, keep that here locally, support the local economies, and we're continuing to stay focused on those efforts. I participated in a listening session around the state, including here in Richmond, last year to hear from community members about what food insecurity looked like and food access issues. One of the predominant themes from that was just collaboration. And you've heard some of these themes today.
Right.
That it's one of the greatest predictors of food insecurity is housing security, right?
Right.
We can get someone into stable housing, we're more likely to be able to get them to a place of food security. And I think there's certainly opportunities for us to work collaboratively with other advocacy organizations at the state level on these issues that support working and low-income families. But also in your localities. How can you work with your local government agencies, your local DSS offices, your local pantries, school systems, et cetera? There are opportunities for collaboration convening. And to me, that is one of the more effective forms of advocacy, because I think we all see what happens in Washington, and it's not always the best return on investment in regards to your time. Nothing ever seems to happen too quickly there. But at the local level, I just really encourage that. I do want to put a plug in, though, because we've talked about just how critical these federal programs are, especially the federal nutrition programs, if we're going to help provide food access throughout this crisis. And I think folks are probably aware that conversations are ongoing in Congress for stimulus. And I think it's really important that everyone who's involved in this issue, that you reach out to your legislators and let them know that these programs are a priority for you. We're asking for three things specifically. We're asking for a 15% increase in SNAP benefits. I think everyone who's been to a grocery store seen food prices are going up. SNAP already doesn't last folks the whole month. So many more people are going to need it. We really need to boost SNAP benefits throughout the country to take some of the pressure off the food bank system. We need to increase the minimum benefit that folks get for SNAP. A lot of people only get $16 a month in SNAP benefits, especially seniors, because their other benefits like Social Security and Medicare are counted as income.
Is it 16 a month?
16 a month, that's it. And so we're asking that the minimum be increased to at least 30, which still doesn't go that far, but it's better than 16. And then the third thing is, given all the uncertainty with schools this year, and how much those kids rely on school meals, we need to just make school meals free for everybody in the country, at least for this year. I think there's a good case for that to be made anyway, that this should be viewed as a resource. You know, we don't make fifth graders pay for textbooks if they can't afford them. School meals are a critical resource if kids are going to be able to learn. And right now, we are forcing school nutrition departments to go through an administrative nightmare of determining, is this child connected to this school or that school? Are they free, reduced, paid? Instead of just giving them the money they need to serve kids who are in need. So those are the three big things. You know, there's a variety of different ways to do that, to make school meals free for everybody. But I think, you know, even if you think your legislator is in agreement with these things, it's still important that they hear from you, because there's a lot of different priorities out there in these stimulus talks, and we need to make sure that these nutrition programs are as high as possible on everyone's priority list.
Great, thank you. Thank you, Eddie. Shadae or Jana, anything you want to add?
I would say one of the biggest things that we learned is proximity. Brian Stevenson, who wrote the book Just Mercy, he says that you have to get proximate to the people you're trying to serve. And we have to continue to remember that, even in times of COVID, which is all about like distancing, we still have to get close to the people we want to serve, and listen to them and figure out how we can come to them. So proximity is one of the biggest lessons that we learned. And in doing that, really was able to see and continue to learn how this pandemic has really made clear a lot of the racial injustice and systemic racism that has always been ingrained, but we can see those inequalities really clear as you think about who has access to food, who has access to resources, and who doesn't. So again, that learning for some people is new learning. For other people, it may not be, but I think what we have done throughout this process is together is really try to have grace and really start to unpack a lot of those things for so many of our communities have been prevalent for so long. So I think, again, proximity and then the willingness to learn and grow together have been the biggest things that as a school system we've learned throughout this process.
Thank you. Anything, Jana, that you want to add?
Yeah, just real quick. I think advocacy also more at the very local level, and making sure that you are personally learning how, and your agency is personally learning how to help and spread that. And so whether that is using Help One RVA to find where those resources are in the proximity of those individuals, or your organization is doing these things, I think that is also part of advocacy, is knowing what is already there in your community outside of our own. So that way we can build off of each other and support and help each other and reinforce each other's messages. So I think that's also a piece of this puzzle is, you know, communicating up to our lawmakers and our change makers, but also being a change maker right here in our backyards and making sure that we know what is in our own backyards.
Well said. Thank you. You know, we have about 10 minutes to go, but I'm going to ask this next question, but it will allow each of you to sort of make your closing statements, if you will, or just to make sure we cover as much as we can. This has been content rich, incredible insight from each of you. So this is an important conversation. So let's think about this. How can people who are on this call maximize their influence to fight or address hunger, food insecurity, and advocate for this topic as well? What are your thoughts on that?
Doug? I'm happy to go. In terms of learnings, one of the things I've seen recently is we as human beings have such a need to hang our thoughts and our hopes onto something. We hoped the heat would kill the virus. We hoped the government would flood the zone with testing. We were sure we'd be ready to go back to school in the fall. And what I'm finding throughout my own organization, throughout our community, is where is there to hang hope on right now, right? Because some of those things just didn't come to pass. So what I've told everyone is here's the deal. We must accept living in ambiguity. We must accept living. It's easier for some than others. We must accept living in ambiguity and take a look at where the future's headed and at least try to deal with it in as thoughtful and planful a way as possible. So we know the virus is with us for a good long time. We took a sequential approach. It didn't work. There's going to be a fall surge that could affect the market, which really lays bare, to Shadae's point, lays bare in this country, in this society, the differences in the haves and have-nots and the inequalities that are prevalent throughout. What I'd also ask people to do, what they could do to help, is, no offense to my chief development officer, please don't think of just food banks. Don't believe that mental health isn't a huge issue, that domestic violence isn't running rampant when people are cooped up like this, that transportation is a bigger issue than ever, that rent, the ability to stay in your apartment or wherever you are, that employment services, there's so many causes out there people really need to put their minds on. It does get down to, for the near-term, government assistance. We'll see what they do. It could go really well. It could be a halfway measure, and it could be nothing, and that could be tough on everybody, and we will get through that. Food supply, there may be some more surges. I really think that the retail industry kind of figured it out. They haven't fixed their supply chains completely, but we now know not to panic. We now know some of that will exist. And we are working hard on this model to be much more predictive and even better at what we do, not only from our point of view for food insecurity, but maybe with other services that, Reggie, you look after and the city looks after. I know you've been a proponent of that, and I really encourage that. And I'll just end up with, having been through this and being with these fine folks, that I have found in life that the most resilient thing in life is the human spirit. And no doubt, we will get through this. We will live and learn to accept and live in ambiguity, ground our decisions, have good, thoughtful, proactive, non-dramatic leadership, like I see every day through my friend Reggie there and others here on the call. And we'll get through it, and we'll be stronger. It won't be pretty, but we're in this for a good another 8-9 months, and we'll come out to the other end.
Thank you, Doug. I'll go to Shadae.
I would say I really loved Eddie's 3 things that you can advocate for. I think that we are all advocates, and really just making sure everyone feels they have a voice and sharing that voice. I would say the power really lies within the community. And if we can really rally around those things and make demands that, school lunches are free. The amount of time that we have to put in to get waivers, to feed students for dinner and weekend meals is extensive, and that should be a right for every student without fear of not being able to fund the program. So I think advocacy is huge. And then we still need help. We still need volunteers. If you are willing and able, I just encourage you to visit our website, www.rvaschools.net. And you can just, see our Reopening with Love plan, but also where you can fit in and just help us. We will need your support over the next 9 months, whether it's something on the ground, in person, no contact visits, to make sure all of our families know about the resources, or if it's making phone calls. But we definitely will need the support of the community. I've been amazed by how we've rallied together already, and we are just going to continue to need and rely on your support.
Thank you, Shadae. Next, we'll go to Jana.
Yeah, I think I will always advocate for just going on help1rva.org and
Right.
looking around and becoming familiar with that. And then we have a 45-minute webinar where anybody can learn how to use it to be a helper for another individual. So if somebody walks into your office or into your program and they are looking for assistance, and maybe that's something you normally do, or maybe it's your place of worship and you're hearing somebody is in need, you can jump on there real quick and help people navigate to whatever that need might be that's convenient for them. So just learning and having that tool in your toolbox, I think is always crucial to have as many tools as we can. But then also thinking about what is your workflow, what is your agency's workflow, and how does it help in that long-term sustainability, that intersection of all the different programs that are out there in your community, and how do we what does that look like? How do you have some intentional conversation with your program partners around your community, and how do we whether it's sending and receiving referrals or adding a search bar on your own agency's website, whatever that might be, just being intentional and having some thought around what's our workflow, what's not going to overwhelm us, what do we have capacity to do, and how do we use this tool to help it be better.
Beautiful, thank you. And Eddie.
If you're participating on this webinar, it means you've already taken the first step and you have an interest in this issue and are willing to use your time and talents and energies to help us address it. So I appreciate that. I just really want to encourage everyone to use your voices as well. I saw a lot of folks are volunteers, and that's wonderful, but speaking up on behalf of these folks is really important as well. A lot of them don't always get heard and aren't always represented, of the food insecure families that we serve. And so they need allies like us speaking up on their behalf. Food, Maslow's hierarchy of needs. Food is the most basic thing. If we don't start with that, if we don't have that as a foundation, then it's going to be very difficult for families to thrive. And working together, I'm very confident that we'll get through this crisis and help families to the other side.
Great, thank you, Eddie. Thank you, Doug, Shadae, Jana, and Eddie, of course, for your participation on this panel. I'm sure that the participants have really learned a lot and really appreciated the complexity of this work, but also I think there's hope because we have such compassionate people who are trying to open doors of access for this most basic of human needs. So I'm proud to be one of your colleagues on this journey, and I would ask everyone that's participating or has joined us on this webinar, please reach out to any of us so that we can answer any questions you might have, or just further educate yourself on how you can move the community forward. There's lots of misinformation, so this was a time where we wanted to just share from the people who do this every single day the facts. So thank you all for the work that you do. These are challenging times, but I'm really grateful for the work that's being done in Richmond.